Now let us discuss about the physical injury of the soft tissue. First is the linea alba. So, what is linea alba? Linea alba, it is a white line. It is a white line that is seen on the buccal mucosa. The white line seen on the buccal mucosa that is seen posteriorly at the level of the occlusion plane. So this figure represents the linea alba. So why it is caused? It is caused by physical irritation and the pressure that is exerted by the posterior teeth. So it is usually bilateral and pronounced in person who have clenching habit or history of the bruxism. So histological, what you will see is hyperkeratosis and intracellular oedema of epithelium that is easily noticeable. Second is the toothbrush trauma. So toothbrush trauma that will occur to the gingiva and is produced by the toothbrush. So what you will see, it appears as whitish, reddish or ulcerative lesion or linear superficial erosion involving the marginal or attached gingiva of the maxillary canine and premolar region. So you can mistake this toothbrush trauma for the vasculobullous lesion or infectious lesion if the history is not taken correctly. Severe form of toothbrush injury, what you will note is the patient showing the clefting of gingival margin and can show the gingival recession. In the severe form, you will see notching of the tooth and loss of the alveolar bone. So patient can come and presents with the pain and the burning sensation. So this type of injury is generally caused by the faulty toothbrushing or rapid or aggressive practice of the cleanliness. Next can be toothpick injury. So this toothpick injury is result of overzealous oral hygiene practice. So it will involve the interdental gingiva. The treatment consists of medication to relieve the symptom and teaching the proper brushing technique or the flossing technique. Other is the traumatic ulcer. What is the other name of traumatic ulcer? Decubitus ulcer is the other name of the traumatic ulcer. The traumatic ulcer of the oral mucous membrane itself says that it is caused due to some form of trauma. What could be the trauma? The injury that can be due to the biting the mucosa, the denture, the orthodontic appliance, toothbrush injury, exposure to the mucous membrane, or any sharp tooth or carious tooth that may injure to the mucosa by some external irritant. What is cotton roll injury? The cotton roll injury is common reaction when the dry cotton the roll is placed by the dentist while the treatment and is roughly removed and the mucosa adhering to it gets torn. So what are the common site of traumatic ulcer? They are most common on the lateral border of tongue, usually after the injury in which the patient severely bites the tongue. These ulcers are also seen. They are however more common on the buccal mucosa, on the lips and occasionally on the palate. So in the case of traumatic ulcer of tongue, that will resemble a close resemblance to the carcinoma. How will you manage the traumatic ulcer? So the management of traumatic ulcer that consists of treating the symptoms. However, the ulcer will heal promptly when the irritant is removed. Next comes the traumatic ulcerative granuloma with stromal eosinophilia, or it is known as eosinophilic ulceration or traumatic granuloma. It is renamed by the word TUGSC that represents the eosinophilic ulceration from more aggressive lesions. So it is a reactive, benign, asymptomatic, self-limiting lesion of the oral mucosa. So it may resembles resemble like a squamous cell carcinoma at the times and associated with the trauma. What is the pathogenesis of this disease? It is probably the T cell mediated. The trauma the trauma may be due to the malpose teeth or the partial denture. In the infant, you can see the erupting teeth may cause sublingual ulceration that is referred as Riga-Fede syndrome. So these ulcerations they may occur at any age but more common seen with the males. It is common in anteroventral and the dorsal surface of the tongue. These lesions may be observed in other sites like gingiva, palate and mucobuccal fold. These lesions, these ulcerations may persist from week to month and resembles just like traumatic ulcers. The treatment is as similar as the traumatic ulceration. The large eosinophilic ulceration that will heal rapidly after the biopsy, though extraction of involved tooth can sort out the problem, as in case with the Riga-Fede disease. The teeth should be retained only if they are stable. Next comes the factitial injuries. They are the self-induced injuries that can be due to the number of factors like cheek biting, lip biting, etc. So these other name is morsicato labiorium, morsicato buccarium. So these injuries are habitual or psychogenic. So what you will see is biting and tearing of epithelium of the lip, buccal mucosa or the tongue. Patient, what they do is they generally chew their cheek or cause stripping of the epithelium using fingers or creating negative pressure by sucking the lips and cheek. So such type is seen in patients who are under psychological stress. The habitual gingival injuries in which the patient presses the attached gingiva with her nails or forces the free gingival margin apically. So these type of lesions are usually bilateral and seen along the occlusion line and on the vestibular surface of the lips. The mucosa will appear white with area of redness. Ulceration is more common. This condition is more seen in females. So on histological examination you will see extensive area of hyperkeratosis with keratin projections that represents the ragged areas. Treatment consists of counseling and psychotherapy and acrylic shield that can be used to prevent the access of teeth to lips and the cheeks.